Hello, my name is Sean. I'm an occupational therapy student, and we're just going to do some cranial nerve tests for you today. And these are done just to really assess to make sure that your sensory system is working correctly for different things like your facial movements, sensation, tongue movements, eyes, sense of smell, and hearing and balance. These are really important for us to do just to make sure that everything's working properly, and then we can kind of do our assessments for interventions and things like that based on the results from this, so better treat you as our client. The assessment shouldn't take really much longer than 10 minutes, give or take a minute or two. And then is it okay if I go ahead and assist you with some of these parts of the assessment? So I might have to touch like your jaw, your face, your shoulders, things like that.
Yeah.
Okay? Cool. Great. So to go ahead and start, we're going to do a sensory of your smell. So what I'd like you to go ahead and do first is you're going to go ahead and close your eyes, and then I'd like you to go ahead and close one nostril. Just let me know what you smell, if anything.
Smell like eucalyptus, citrus.
Good. And then I want you to go ahead and keep your eyes closed, and then go ahead and do the other nostril. Perfect. Let me know.
Like cinnamon, vanilla, fall.
Okay, good. Perfect. So that's showing that like your olfactory nerve is working properly. Now we're going to do your eyes just to make sure that the pupils are working correctly and all that good stuff. So what I'm going to do is I'm going to shine this light across your eyes to make sure they restrict. So go ahead and just focus on my nose. Good. Perfect. Now I'd like you to go ahead and just cover the eyes. Good. And then that's just to see if they dilate correctly. And now relax. And then they're going back to normal size. So that shows that that optic nerve you have is working correctly too. So perfect. Okay. Now to do more of the optic nerve, what I'd like you to go ahead and do is stand. Now have you step right about here. Good. And then just read the line from the Snellen chart for me. Line number 4.
LPED.
Perfect. Now go ahead and grab a seat for me again. Okay. So now what I'd like you to go ahead and do is, looking straight at my nose, I am going to pull different colored objects from different angles. Just let me know when you see them. Just let me know what color it is. Okay? Good. Just let me know.
A green.
Good.
Orange.
Good.
Orange.
Okay.
Green.
Okay, good. Now we're going to do the same test, but I'm going to do numbers. Okay? So let me know what numbers you see. Okay?
1.
Good.
2.
Good.
3.
Close.
2.
Yeah, good. Perfect. And do you normally wear glasses or anything?
No.
No? Okay, good. Now what we're going to do is a test for your oculomotor and your trochlear and your distance nerve. So it's 3 different nerve tests in one. So what I need you to do is just not move your neck or head, and you're just going to follow this orange marker, right? So just go ahead and follow with your eyes. Don't move your head. Perfect. So that shows that nerve's all intact and everything, so that's always good. So now what we're going to do is a nerve test for your trigeminal nerve, which is going to be a sensory test and like a test for doing like motor movements and things. So can you put your hand out for me? So I'm just going to tap you with this just so you know how it feels. Just doing a cotton ball. I'm going to tap your forehead, cheek, and jaw. Just close your eyes for me. Let me know when you feel it. I'm going to be doing both sides.
Feel. 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 Feel.
Good. Shows that that nerve's all intact. So now we're going to test for dull and sharp sensations, right? So what I'd like you to go ahead and do is put your hand out for me. This is going to be the dull.
Okay.
Okay. This is going to be the sharp.
Okay.
Okay. So closing your eyes, just let me know what you feel, if it's dull or sharp.
dull, dull, sharp, 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 dull.
And that was good on that test as well. So now we're going to do a reflex test of your eye really quick. So what I just need you to go ahead and do is just stare straight for me and just try to relax. Good. Perfect. So you shut your eyes in a reflex. So that was a good test. It shows that your nerve is working correctly. So now what I'd like to go ahead and do is a manual muscle testing for this nerve. So I'm just going to have you first go ahead. I'm going to touch your jaw. So just go ahead and clench your jaw. Good. And then try to open your jaw. Perfect. And relax. Good. Now we're going to do this jaw jerk reflex. So I just need you to relax your jaw and have your mouth open. And I'm just going to give it a tap. Good. If there was something wrong with this nerve, your jaw would have just closed like rapidly shut. But it didn't for you, so it's actually a really good sign. Now we're going to do a test for your facial nerve. So what I'd like you to go ahead and do is just look up and crinkle that forehead. Good. And I want you to smile really big. Good. Frown for me. Good. And then puff out your cheeks. Perfect. So that shows that that facial nerve is working correctly for your face and everything. All those facial movements. Good. So now what we're going to go ahead and do is we're going to do vestibulocochlear nerve tests. And so that does your hearing and balance. So I've already pretty much assessed your hearing because you can hear what I'm saying, correct? Yeah. So now what we're going to do is your balance. So we're going to do both dynamic and static balance. So that's going to be like a movement balance gait. And it's going to be like a standing still balance, okay? So if you could, since you're already seated, we'll do the movement one first. It's a tug assessment. So as a timed up and go, what it is when I say go, you're just going to stand up as fast as you can. You're going to walk around the red box and then come back and sit. Your time starts as soon as you stand, as soon as I say go, and it ends as soon as you touch the chair, okay? Ready, set, go. Good. Now it was like 7 to 8 seconds, so that shows that you're like a low, not a fall risk pretty much at all. Okay? Now for the next test, I want you to go ahead and stand up for me. Good. And then I want you to put both feet together, and then you're going to cross arms and close your eyes. You're going to close your eyes, and you're going to hold the position for 30 seconds, okay? Ten more seconds. 5, 4, 3, 2, 1. Good. Your balance is all good. So go ahead and grab a seat for me. So now what we will do is the glossopharyngeal and vagus nerve testing. So these are going to be more like your nerves that do for swallowing and things like that. So what I will do is I'll grab my light. Just say hi for me.
Hi.
Good. Your voice quality sounds great and everything like that. So that's a good sign for this as well. So then I'm going to have you say ah. I'm going to put this light in there because I want to see if your soft palate goes up and then everything else is working properly. So open. Ah. Good. And everything looks fine. If it didn't do that correctly, then it would just show that there's some impact from this nerve as well. So now what we're going to do is a nerve assessment for your accessory nerve. This nerve works with two muscle groups for you, for shoulder movement and head and neck movement. So what I'd like you to go ahead and do is I'm going to apply pressure to your shoulders and just try to shrug. Good, relax. Now what I'd like you to go ahead and try and do is put your right ear to your shoulder, and I'm just going to apply pressure and relax. Other side. And relax. Good. And then what I'd like you to go ahead and do is you're just going to go ahead and turn. So you're going to turn your head to the right, and I'm just going to apply pressure. And then relax. And the other side. And relax. good. It felt okay?
Yeah.
Good. It shows that nerve's working correctly for everything and that your neck muscles and everything are getting the right sensory stuff. So that's good. Now what we're going to go ahead and do is a hypoglossal test nerve. This is the last nerve to test, okay? So what I'd like you to go ahead and do is stick your tongue out straight for me. Good. And then I'd like you to go ahead and do rapid side-to-side tongue movements. Perfect. If you had any kind of impairment or anything with this nerve, then I would see like a reflex or like a sharp kind of abnormal movement, but you don't have that. Everything looks good. So now all I need you to say is just to repeat a sentence for me. That's going to be, the quick brown fox jumped over the lazy dog. The quick brown fox jumped over the lazy dog.
The quick brown fox jumped over the lazy dog.
Perfect. So if I had detected that you had done a little bit of messing up with that sentence or something was kind of like slurring, then that would also show like an impact to this cranial nerve as well. Good? And we're all done.
All right, thank you.
Yeah. Hello. The cranial nerve that I selected for if it was having any kind of a dysfunction and the impacts that it would have on occupational performance would be the vestibulocochlear nerve. This is because this nerve would impact a lot of aspects of just being able to participate in occupations. So for the BPS model in comparison, so for biologically with the vestibulocochlear, it would impact both their balance and ability to hear, which can play significant roles and factors into their psychological and social aspects. With the biological as well, obviously their balance would be impaired, which would impair their ability to move around safely in their home, in their community. This would lead to having that decreased socialization because somebody might not be able to move around the community safely and get to events, get to friends or neighbors' homes to be able to participate in activities with them and just to socialize. It might just hinder their confidence to be able to do that. And then lastly, the psychological aspect would be impacted really because not being able to socialize like that, not being able to be independent in that ambulation and being able to walk, that could lead to a lot of signs such as anxiety and depression. Depression because they're not able to go and participate in things that they love to do. And then safely, they could be really worried, which can lead to that anxiety of having this constant fear of falling or just not being able to really understand their surroundings with loud noises or anything going on because they have that impact of hearing. But the balance would play a large factor in this decreased ability to participate in their occupational performance. So the vestibulocochlear nerve would be of huge impact to someone's daily living.